Midazolam Hcl is a medication that is used by children before a procedure or anesthesia to cause drowsiness, decrease anxiety, and cause forgetfulness of the surgery or procedure. It should be used while the child is under the care of a health professional and is not for home or long-term use. This medication belongs to a class of medications called benzodiazepines, which produce a calming effect on the brain and nerves, central nervous system. It is thought to work by increasing the effect of a certain natural chemical, GABA, in the brain. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. Your healthcare professional will prepare and measure your dose of Midazolam Hcl. You will take this medication by mouth as directed by your doctor, usually as a single dose before a medical procedure or anesthesia. The dosage of Midazolam Hcl is determined based on your medical condition, how you respond to the treatment, your weight, and any other medications you may be taking. While Midazolam Hcl can be beneficial for many people, it's important to be aware that it may sometimes cause addiction. This risk may be higher if you have a substance use disorder, such as overuse of or addiction to drugs or alcohol. It's crucial not to increase your dose, take it more often, or use it for a longer time than prescribed. If you find that the medication is no longer working well for you, make sure to talk to your doctor. And when it's time to stop taking the medication, be sure to do so as directed by your healthcare professional. It's important to avoid consuming grapefruit or grapefruit juice while using Midazolam Hcl, unless your doctor or pharmacist has specifically said it's safe to do so. Consuming grapefruit can increase the likelihood of experiencing side effects from this medication. If you have any questions or concerns about this, be sure to consult your doctor or pharmacist for more details. Some common side effects of Midazolam Hcl include nausea, vomiting, dizziness, or drowsiness. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits to you outweigh the potential risks. Many people using this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as changes in mental or mood, uncontrollable movements, changes in heartbeat, or vision changes. In rare cases, a very serious allergic reaction to this drug may occur. If you notice symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Taking Midazolam Hcl comes with some serious risks. It can be addictive and can lead to overdose and even death if not taken as prescribed. It's important to take the smallest effective dose for the shortest amount of time possible to lower your risk. It's also crucial to avoid alcohol and other drugs that can cause drowsiness or breathing problems while taking Midazolam Hcl, especially opioid medications like codeine or hydrocodone. If you experience slow or shallow breathing, severe drowsiness, or difficulty waking up, seek medical help immediately. Suddenly stopping Midazolam Hcl can also lead to serious withdrawal symptoms, so your doctor may gradually lower your dose to prevent this. Be sure to report any withdrawal symptoms such as headaches, trouble sleeping, restlessness, confusion, depression, nausea, or seizures to your doctor or pharmacist right away. These symptoms can last for weeks to months, so it's important to address them promptly. Before taking Midazolam, make sure to let your doctor or pharmacist know if you have any allergies to it or other similar medications. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist about any concerns. It's also important to discuss your medical history with your doctor or pharmacist before using Midazolam, especially if you have kidney or liver disease, breathing problems, heart disease, glaucoma, or a personal or family history of substance use disorder. Midazolam can make you dizzy or drowsy, and using alcohol or marijuana can increase these effects. It's important to avoid driving or using machinery until you know how midazolam affects you. It's also important to avoid alcoholic beverages and talk to your doctor if you are using marijuana. Before having surgery, make sure to inform your doctor or dentist about all the medications and products you are using. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about the risks and benefits of using midazolam. This medication can harm an unborn baby and may also pass into breast milk, so it's important to consult your doctor before breastfeeding. Infants and children under 3 years old who are using midazolam for procedures or surgeries may be at risk for slower brain growth, so it's important to discuss this with your doctor as well. When taking Midazolam Hcl, it's important to be aware of potential drug interactions. Certain medications can change how midazolam works in your body, and may increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Midazolam Hcl include HIV protease inhibitors, sodium oxybate, and certain antibiotics. Other medications can affect how midazolam is removed from your body, which can also impact its effectiveness. It's important to discuss any potential interactions with your healthcare provider. Taking Midazolam Hcl with other products that may cause drowsiness or breathing problems, such as opioid pain or cough relievers, alcohol, or certain anxiety medications, can increase the risk of serious side effects. It's important to talk to your doctor or pharmacist about any other products you are taking, and to check the labels on all your medicines for ingredients that may cause drowsiness. If someone has taken too much Midazolam Hcl and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include drowsiness, confusion, and loss of coordination. It's crucial to act quickly in these situations to ensure the person receives the necessary medical attention. It's important not to share this medication with others as it is against the law. This medication has been prescribed specifically for your current procedure, and it should not be used for any other condition or procedure unless directed to do so by your doctor. In that case, a different medication may be necessary. While taking this medication, it's important to have lab and/or medical tests, such as breathing, blood pressure, and heartbeat, done regularly. Make sure to keep all medical and lab appointments and consult your doctor for more details. The daily dosage and optimal timing for taking Midazolam Hcl will depend on your specific condition and the procedure being performed. Your doctor will provide you with detailed instructions on when and how to take this medication. Midazolam Hcl is used to produce sleepiness or drowsiness and to relieve anxiety before surgery or certain procedures. It is also used to produce loss of consciousness before and during surgery. Midazolam Hcl is also used to cause a state of decreased consciousness in patients who are on a breathing machine. This medication is typically administered by a healthcare professional in a hospital, clinic, or doctor's office and is not meant to be stored at home. It is used to help people relax before surgery or medical procedures. The dosage and timing of administration will be determined by your healthcare provider based on your specific needs. It is important to follow their instructions carefully and not to take this medication at home without proper supervision. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.